There's a lot of things that change when you become an attending that it's really hard to prepare for. And one of those things for me has been picking my battles. Every day, there's so many little decisions and little things. And depending on the structure of your ICU and your hospital, you may have full control over decision making. Like if you want the ship to go left, the ship is going to go left, or you may have less, where you have other people involved in that patient's care and you want to be mindful of incorporating their opinion, their expertise, everything else. And so, I think I'm coming on almost 2 years now as an attending, so it's not like I've been doing this for 1,000 years or anything. But in the beginning, I felt very reactive, Everything really would get to me. Like, what? What's that? Why? What? No, we can't do. And now I'm finding myself being more picky about what needs escalation, or what is something that I really want to put my foot down about versus what is something that's like a stylistic difference that's not really a big deal in the big picture of things. Obviously, if there's a clear answer that option A will benefit my patient, option B will harm them, I'm going to be very verbose and intense about making sure my patient gets the better option. But a lot of times medicine isn't that clear, and those can be really interesting things to navigate as an attending. How do you negotiate a difference of opinion? How do you negotiate a difference in assessment? How do you decide which way to go when two people want to go different ways? And we've all seen the memes about like cardiology, nephrology, about Lasix and fluids, like the endless thing, right? But not just that. There's so many other examples in the ICU and in general, So I don't know. That's something I'm still navigating, but I'm finding that over time, I'm becoming more judicious of what is worth getting really into it and what is not worth, And if everything's a big deal, then nothing's a big deal, right? So you have to kind of just pick your battles. I don't know. Let me know what you think.